everybody, welcome to my talk today that offers a simple overview of key terms and standards relating to nurse education in the UK. That includes areas such as pre-registration education, preceptorship and clinical supervision and lots more. So this talk should be helpful for anyone preparing for a nurse educator interview or any learners on nurse education modules as a resource for assignments, and I'll be signposting some key references to help you. Just to note, I've lots of other videos on my YouTube channel to support nurses' career development. There's a video on how to become a nurse educator in the UK and different roles, and a video to help you prepare a nurse educator interview. So if you've got an interview coming up, do check it out. If you find this video helpful, don't forget to give me a like and press the subscribe button. I release videos on Sundays and they're all free, and I hope you find it helpful. So I thought it would be helpful just to start with practice supervision roles in clinical practice. You'll often ask questions about supporting students or a range of learners in placement in nurse educator interviews, and these roles might form part of an answer to an interview question, so you need to understand the difference between them. We've got three key roles in the UK. They are practice supervisor, practice assessor and academic assessor. The term mentor was phased out by our Nursing and Midwifery Council and replaced by these roles. So a practice supervisor is the person who supports and supervises students on a day-to-day basis in clinical practice. So the student or a trainee nursing associate may have several practice supervisors to cover different shifts they're on. They could just have one practice supervisor if they're working on every single shift with the same person, but usually they do have several practice supervisors. The practice supervisor should have current knowledge and experience in the area to support the learner, and you can be a practice supervisor for a first year student or a trainee nursing associate quite early in your career, for example 1 year post registration, as long as you've had the correct training and you feel able to. The practice supervisor is a role model, and their main role is to provide feedback on a learner's progression so that they're contributing to their record of achievement. They observe the student in practice, feedback on their conduct, their competence or proficiencies for them to be able to be signed off for that placement. So in summary, they're providing key feedback and evidence for the learner to progress in comparison to a practice assessor who conducts the assessment. And the assessment is to confirm that the learner has achieved the proficiencies and programme outcomes for practice learning or not. Practice assessors cannot be the practice supervisors. You can't have both roles. They're different roles for each student. The practice assessor assesses that the learner can demonstrate the specific knowledge, skills and attributes required for the placement and their nursing programme. The assessment the practice assessor conducts is informed by all the feedback from the practice supervisors that they review as a whole, and the evidence that the student provides additionally, for example, reflections. So the practice assessor is using evidence from student records as well, how many days they attended, as well as their reflections and practice supervisor feedback. Then we've got the academic assessor. Now the academic assessor has a fuller overview of the learner's progression that includes their programme, the university programme, all the feedback from placement. So an academic assessor confirms the student achievement, proficiencies and programme outcomes for each part of the degree programme. So they're the person that recommends whether a learner can move forward to the next placement and the next year or part of their degree programme using this evidence-based decision. They're drawing together all the evidence, they take into account environmental issues, practice supervisors' feedback and assessment from the practice assessor. So they're looking at what's been going on in the placement as well as a whole. For example, during COVID, they might have made a decision where an extension was requested because there was a high lot of sickness, lots of practice supervisors were off sick, or wards were moved and reconfigured, for example. So some key educational standards linked to placements. Firstly, you should review the Nursing and Midwifery Council standards of proficiency. So we've got standards of proficiency for registered nurses and standards of proficiency for nursing associates. I've got references at the end of the slides. The NMC standards of proficiency for nursing associates are currently structured under 6 headings, as opposed to newly registered nurse proficiencies that are structured under 7 platforms. So it's helpful to review the difference between the proficiencies. The Nursing Midwifery Standards of Proficiency for Registered Nurses document, for example, outlines Platform 7, Coordinating Care. And newly registered nurses should play a leadership role in coordinating and managing the complex nursing and integrated care needs for people across a range of organisations. In comparison, a nursing associate should contribute to integrated care. So you can see the difference between those proficiencies, where the registered nurse has a more leading role versus the nursing associate, where it's they're contributing to care. So that's important to review. This video is being done in August 2023, and there may be changes as our profession's always evolving and standards change. So whenever you have an interview, always review the Nursing Midwifery Council website for updates relating to standards of proficiency, education and training. If any of you are applying for a role where you are supporting nursing associates, it's important to know about the difference between a nursing associate and a registered nurse, or support workers and an assistant practitioner and a nursing associate. So I do have a helpful video on my YouTube channel that outlines those differences, so do check that out. And I also have 2 new videos coming out on apprenticeships and what they are, to help guide support workers and nursing assistants that want to progress using an apprenticeship route. So if the role you're applying for involves supporting support workers or nursing assistants, they may want to progress and aspire to become a nursing associate or a registered nurse, and you might be supporting them whilst they're on an apprenticeship, or you might be encouraging them to apply to retain them in a role. So I have 2 videos coming out in the future explaining what these apprenticeships are that you might find useful. It's important when preparing for any interview to review national standards relating to the role. So as a nurse educator role, this is going to be key educational standards. All of our current nurse educational standards are found on the Nursing Midwifery Council website. The ones detailed on this slide were originally published in 2018 and have been recently updated in 2023. And in the future, these standards are always evolving and changing. This talk is in August 2023. However, you will find all relevant standards on the Nursing and Midwifery website. So we have the Nursing Midwifery Council Part 1 Standards Framework for Nursing and Midwifery Education, Part 1. We have the NMC Part 2 Standards for Student Supervision and Assessment, and the NMC website also has helpful supporting information for these standards for student supervision and assessment, and a helpful webinar and videos on their website too. NMC Part 3 details all programme standards. So these standards set out the entry and practice learning requirements, the curriculum, length of programme, methods of assessment, and the level of award for NMC approved nursing programmes. So they're good to have a read through. We've got standards for pre-registration nursing programmes too. That includes pre-registration midwifery programmes, standards for pre-registration nursing associate programmes, and because some of you may be supporting trainee nursing associates. We also have standards for post-registration programmes, standards for prescribing programmes, and standards for return to practice programmes, for example. So all of the standards will be found on their website. As a clinical nurse educator, you might be helping support an internationally educated nurse before they register with the Nursing Midwifery Council. So sometimes we have support workers, for example, who are an internationally educated registered nurse from India or the Philippines, and they are trying to complete an OSCE assessment to become registered in the UK. You might also have people that are currently going through the process of just having an OSCE assessment, which is an observed structured clinical examination to become a registered nurse, or you may have people arrive to your area who are new to this country. They're internationally educated nurses who have already registered with the Nursing and Midwifery Council, and they need to get used to different ways of working, our policies and our guidelines. So it's helpful to know about the process. And what I would say is your role as an educator is to signpost to the correct websites. You don't want to be giving them the wrong information. You don't want to be completing forms for them in case you do it wrong. So initially, the qualifications for an internationally educated nurse are assessed, which includes English, and there is national guidance on language requirements on government websites. This has recently been changed, and I always advise, as I said, the person inquiring to go onto the correct UK government website and Nursing Midwifery Council website so you don't give the wrong information. Currently, there is a Part 1 test of competence, a computer-based test that covers 2 parts, one for numeracy and the second part covers clinical nurse questions. So you might be asked questions about supporting internationally educated nurses. So it's helpful for you to know what currently is in place. But if you go for this interview in a few years' time, you need to check current websites. In 2023, there is a Part 1 test of competence, as I said, computer-based test. The next test is Part 2, test of competence, and that's a practical exam. It's the objective structured clinical examination, the OSCE, and in this part the person will be tested on their clinical and communication skills. Once registered, the internationally educated nurse registered with the NMC needs a period of support to adapt to the United Kingdom. They might be newly registered, so you must check that, and they should still be allocated a preceptor and be supported as a UK educated nurse would. But even if they're very experienced, they still need, there'll be that transition period where they're getting used to UK policies, standards, guidelines, and there's cultural differences, so they will need support for that transition period. 2 key websites to signpost are the Department of Health and Social Care. They publish guidance for international applicants when applying for health and social care jobs in the United Kingdom, and provide applicants with information about the process of recruitment, working rights standards to help them make the correct decisions, and then the Nursing and Midwifery Council website for updates. As a clinical nurse educator, you're usually developing and supporting support workers and nursing assistants to advance their skills with additional training such as Level 3 National Vocational Qualifications or the National Care Certificate. And the Care Certificate consists of 15 standards of learning outcomes and competencies expected of a nursing assistant. So do check out the Care Certificate if you are, that is part of the job description and the role that you're applying for. The Care Certificate should be completed if you're new to care and should form part of a robust induction programme. The Care Certificate was jointly developed by Skills for Care, Health Education England and Skills for Health. So you're going to find more detailed information on those websites. Support workers might also want to complete an apprenticeship. There's all different levels of apprenticeship from level 2, 3, 4. And you may become an assistant practitioner or nursing associate using an apprenticeship to complete a level 5 foundation degree. And as I mentioned earlier, I've got some videos on those apprenticeships if you want more information. When you're signposting to support workers, they will find information on NHS department websites and employer websites for apprenticeships as well. So I've presented some of the key terms and standards linked to pre-registration and support of support workers, a range of learners, registered nurses, internationally educated nurses. And I'm now moving on to post-registration support and preceptorship, where you are supporting early career registered nurses and nursing associates. So some of the key UK terms and standards linked to preceptorship. So firstly, the terms. Preceptorship period is a structured period of transition for a newly registered practitioner where they're supported by a preceptor to develop their confidence and skills in practice as part of their lifelong learning in nursing. Note the term preceptorship is not just related to nurses. All allied health professionals should have a period of preceptorship post-registration. And the Department of Health and the Nursing Midwifery Council advise that newly registered nurses should have a period of structured preceptorship to help their transition from student to registered nurse or midwife or nursing associate. The Nursing and Midwifery Council and Department of Health advise that that preceptorship period should last up to a year. And the aim of preceptorship is to support the newly registered nurse to consolidate their skills gained as a student to be able to enable them to become confident and competent future practitioners. But preceptorship is not just about developing skills. It should also include clinical supervision, well-being support and career conversations. And in the UK currently, preceptorship periods may last anywhere from 3 months to 12 months post-registration, and it's variable across employers. NHS England in 2022 published a national preceptorship framework for nursing that aims to improve preceptorship standards. NHS England recommend a minimum standard and a gold standard in this framework. So currently 6 months is the core standard preceptorship programme length, and 12 months would be a gold standard length. Again, look out for changes and read the most up-to-date version from employers and from your government websites. In England, employers are being assessed and awarded a National Preceptorship for Nursing Quality Mark Award to try and increase the standard of preceptorship across England. Preceptorship should be guided also by role-specific competencies during that preceptorship period and an individualised development programme. The preceptee is a newly registered nurse, midwife or allied health professional who is allocated a preceptor to support their development in practice during their preceptorship period, and a preceptor is the named member of registered staff who is allocated to support the preceptee's development during their preceptorship period. So the preceptor supports the preceptee in the clinical setting by providing an opportunity for them to reflect on practice, receive constructive feedback and have access to relevant post-registration learning, for example. And preceptors should have specific preceptor training to be allowed to become a preceptor as well. So when we look at standards of preceptorship, have a look at the NMC 2020 Principles of Preceptorship that advise that all newly registered nurses should have a period of structured preceptorship to help their transition from student to registered nurse or midwife. As I mentioned earlier, there's no current mandatory requirement for employers to deliver preceptorship, but it's strongly recommended by the Nursing Midwifery Council. So there are variations across employers. Do check out the NHS England 2022 National Preceptorship Framework for Nursing that aims to reduce variations between employers delivering preceptorship programmes in England. They also provide a useful set of resources and standard preceptorship documentation that can be used and templates that can be tailored to employers' needs, so do check those out. The core aim of this framework is to improve the retention of newly registered nurses through these core and gold standards of good practice, so have a look at those and definitely have a read of the framework. It's also interesting, there's differences between UK nations. So in Scotland they have a National Flying Start NHS development programme that's used to structure nurses' preceptorship during the first year registered, and also the Royal College of Nursing's got some great resources and signposting on the Royal College of Nursing website under preceptorship too. I also have a video on preceptorship for nurses that has more detail on preceptorship, for example the requirements to become a preceptor and some of the difference between the minimum core standards and gold standards on the National Preceptorship Framework for Nursing if you do want some more information. As a clinical nurse educator, you should also know about clinical supervision, what it means and how it's provided with a local employer. The Royal College of Nursing has published the Royal College of Nursing position statement on clinical supervision in 2022, and that's helpful to read. And this position paper describes the lack of standardisation of clinical supervision and the definition of clinical supervision that might be interpreted differently across employers. It's important to note that although there are different models and frameworks, it's widely agreed that reflective practice underpins clinical supervision. The Nursing and Midwifery Council refers to supervision as part of an employer's responsibility, so all employers should offer nurses clinical supervision, and it's also part of the Nursing and Midwifery Council standards of proficiency for registered nurses. So clinical supervision is a process for professional support and learning, and clinical supervision provides a safe and confidential environment for you to reflect on practice, to professionally develop and learn. Discussion takes place between clinical supervisor, who's an experienced colleague, and the supervisee, the person being supervised. And a clinical supervisor might supervise you individually, a one-to-one clinical supervision approach, or use more of a group approach within a clinical supervision group. If you'd like to review some clinical supervision resources, clinical supervision has been implemented in a variety of ways, as I mentioned, reflecting different models and frameworks over the years. And I describe these different approaches and models in my YouTube video on clinical supervision, and that reflect normative, formative or restorative models and approaches. We're seeing a lot more resilient based clinical supervision and restorative clinical supervision recently, and training's being promoted in England, for example. If you want to learn more about resilience-based clinical supervision, have a look at Foundation of Nursing Studies website, and there's a facilitators resource page. NHS England is currently supporting the Professional Nurse Advocate A-EQUIP model, a model of supervision for nurses. And A-EQUIP stands for Advocating and Educating for Quality Improvement. And it originally came from midwifery, where all registered midwives were offered clinical supervision in this way. And there's a Professional Nurse Advocate program currently delivering training and restorative supervision for colleagues across England, and that program launched in March 2021. So lots of different initiatives going on at the moment linked to clinical supervision. And the EQUIP model is being linked to quality improvement, as you can see, for example. So do check out, there's different documents you can look at, and different resources linked to sort of those different models. As part of your preparation, you might want to look at the reflection and reflective models. I've got the references for Driscoll and Gibbs at the final slides. You should already be familiar with these reflective models, but just in case you need some revision, Driscoll 2007 model of reflection is the simplest. It consists of 3 questions, but Driscoll did then add further trigger questions to help complete reflection. But you start with these 3 questions: what, which describes the situation or experience; then so what is when you reflect on what you've learnt as a result of this experience; and then the now what actions will we take as a result of this reflection. With Gibbs' reflective cycle, this is a seminal work and used widely across universities. There are some adaptations and there are other models out there, but as I said, Gibbs is widely used as description, feelings, evaluation, analysis, conclusion and action plan. So I do have a video on looking at improving reflective essays, which talks in a bit more depth about Gibbs's reflective model as well. So I hope that helps. It's also helpful to revise the difference between an aim and objective, and just update yourself if you've got an interview for a nurse educator role. For example, you might be asked for your first 3 objectives if you were offered the role. What would be your first 3 objectives? You need to know what objectives are and get used to writing them. Or you might need to write an overall aim for a presentation at an interview. Students, trainee nursing associates will have practice assessment documents that require learning outcomes and SMART goals as well. So I've presented some of the differences between aims and objectives. So put simply, you usually have one overall, 1 or 2 the most, overall statement of intent or desired outcome. For example, I am going to bake a cake for a party tonight, so that's my overall aim. In comparison, you usually have several objectives, and objectives are what you need to do to complete the aim. So they're all the different parts of the recipe. Objectives are less broad than an aim, and they're specific and measurable. So I'm going to whisk 4 ounces of flour and 2 eggs together. So it's what you're going to do to achieve that aim. If you want more detail, look at my YouTube video, Aims, Objectives and SMART Goals. I present aims, objectives, learning outcomes and SMART goals, examples linked to teaching, practice and research. So there's some templates there that you might be able to use as well. Then we have professional development reviews and plans. Different institutions and employers might use slightly different terms, but try to find out how this works in the institution that you're applying for if you can. You can do this on informal visits, for example, or contact clinical educators currently in the role. During your whole career, you should have regular ongoing feedback in a professional development review, or a PDR. In this review, your progression is evaluated relating to your specific role, which informs future plans going forward. And these plans are usually called professional development plans, PDPs. PDRs are based on evaluations of your learning goals, your outcomes, objectives, role-specific competencies, what your aspirations and your career aspirations are. You usually have PDRs 3 to 6 monthly over the preceptorship period, and then they continue for the rest of your career and can be requested more frequently if needed, because they help you review your current needs and plan your future professional academic development. You review your professional experiences with an experienced colleague during these reviews. You discuss your learning development needs, and you can plan for future courses to support your knowledge and skill development relating to your role. So as a newly registered nurse, you might have role-specific Band 5 competencies, for example, that are focused on during your professional development reviews for that first year at least. Whereas when you're 1 to 2 years registered, you might be looking at, you want to review to look at post-registration courses. You might want to discuss where you're at currently in practice, and that you want to become a practice supervisor, for example, and you want to do the training for that, or you want to apply for a specialist oncology course to enhance your skills when you're caring for somebody with cancer. And they tie in with your aspirations as well, that you might want a particular course because you want to pursue a sort of, career progression as well. So hopefully that's helped. I've also got a video on preparing for a professional development review on my YouTube channel as well. It's also helpful to know about the different post-registration types of training, professional development courses and academic courses and levels in nursing. And I've got 2 helpful videos on my YouTube channel. One focuses on the different types of courses, which post-registration nursing courses, but it actually gives an overview of the different types of courses and training available. And the other describes the different internal and external funding streams for UK courses that nursing staff can apply for. So I hope you find those helpful. I thought it would be helpful to mention the collaborative learning in practice, the CLIP coaching model. If you've got an interview coming up, you might have this model mentioned in your job description as a clinical nurse educator. If not, it's still a great topic just to look at in case you're asked about how you keep yourself up to date in nurse education, or you're asked about what was the last paper you read recently, because it's currently being discussed as a future coaching model across nursing and across nurse education. The collaborative learning in practice, the CLIP module, originated in Amsterdam, and it's becoming more increasingly popular, and a variety of care settings in the UK are looking at developing its use. The University of East Anglia is doing quite a lot of work in this area, and they've got some great resources on their website and sort of discussion and some information. The collaborative learning in practice CLIP model is a coaching model where students are encouraged to take the lead in practice, caring for their own caseload. But student learning is still supported. There must be specific learning outcomes set for the day, and the students are coached by registered staff as well, so they've still got that support there. They're not just left on their own. But the idea is that the clinical setting will have a mixture of students from different years, and they can support and learn from each other. So, for example, a first year might learn from a third year final student, and that final year student is developing their managerial skills, their organisational skills, and delegation with a caseload of patients. They might have 4-bedded bay of patients, for example, and they might delegate to a first year and to some support workers under the supervision of their practice supervisor. So it's a great way of developing those organisational managerial skills. You still have to maintain the correct percentage of access of time to your practice supervisor and be coached during this time. There's some resources on NHS England and the Royal College of Nursing website. And as I said, there's quite a few papers now coming out starting to evaluate and pilot this new approach as well. So I hope you found this overview helpful. Do check out your job description for any other key areas. This is just an overview for any clinical educator role, but you might have responsibility for quality improvement, for example, and I do have a playlist on quality improvement on my channel. There's also some helpful videos like ways to welcome student nurses and nursing associates. If you do have a nurse educator interview, I've got some real helpful tips on a video on how to prepare for interviews, and often with nurse educator roles you have to prepare a presentation for a nurse interview, so some good tips in that video as well. So I've presented some references, and you can stop the slides at any stage to get these references. I would always check on the websites, as I said earlier, and I'm also not allowed to put web links on YouTube slides, but these are all really available and readily available on websites for these institutions as well. So I hope you found this overview helpful. Do give me a thumbs up if you did. Do check out my other videos. If you've got any questions at all, put them in the YouTube comments, or if you prefer to contact me privately, you can DM me on Twitter or on my website. And if you're interested in any of my books, you will see links in my description on YouTube to buy the books as well.